So for the first part of my medication administration video, I will be in the medication room pulling the two medications for the my patient. So there's two medications. One is digoxin 125 micrograms tablet, and the second medication I will be pulling is regular insulin, Humulin R, which I will be demonstrating how I will be withdrawing the insulin into a needle of syringe. So the first medication, when pulling digoxin, you will be checking the patient's MAR. So you have digoxin 125 microgram tablet PO daily. So you need one tablet of digoxin. So when you check the Pyxis, you will count how many tablets are in here, and then when you withdraw, how many are left. You will also check the dosage of the medication in each tablet. So in this tablet, one packet has one tablet of 125 micrograms per tablet. So I will be pulling one tablet or one packet for the patient. Now, for the second medication that I will be withdrawing for the patient is regular insulin, which I will be withdrawing the insulin, the amount of units based on the sliding scale. So when I am pulling insulin, I will be, I will complete hand hygiene. I will put on gloves in order to withdraw the medication from the vial into the syringe. So I will have my syringe as well, which I'm using a pencil for. And then I have the insulin vial, which is just a cap for NyQuil. So as I have my gloves on, I will take an alcohol swab, and then I will clean the top of the insulin vial. And then after I have cleaned the top of the vial, I will take my syringe, and then we will be injecting air into the insulin vial. So we check how much insulin we would need. So per the sliding scale, we need 3 units of insulin if the patient's glucose is between 251 and 300. The patient's glucose is 256, so I will be withdrawing 3 units of insulin. So I will have 3 units of air that I will be injecting into the insulin vial. So I'm going to put it in there, straight down, inject the air, turn it upside down so the bubbles will go to the top. Then I will put it back down as the bubbles are escaped, and then withdraw 3 units of insulin after I have injected the air. Now after I have withdrawn the insulin, I will then need another nurse to verify that I have withdrawn 3 units of insulin, that I need to give 3 units of insulin for this specific patient. So as the nurse, I will go to nurse, and then they will come and verify that. Alright, so for the second part of my video, we are in the patient's room. This is my mother. Say that you are.
I'm Jonathan's mother, Antoinette Batula.
18.
I'm over the age of 18, and I'm consent to be videotaped.
So for this part of the video, I will be administering the medications. So first, my name is John. I'm Nurse Day. I have 2 medications here that I have to administer for you at this time. Well, first, can I see your wrists for your ID badge? Could you state your first and last name?
Antoinette Batula.
And then, could you state your date of birth for me?
January 7, 1967.
So we have 2 medications here. Well, first, do you have any allergies?
No.
Okay. So the one medication I'll be giving you, digoxin, that is to treat your heart failure. This is going to be a tablet that I'll be giving you to take. So first, I will be completing hand hygiene before I get into the patient's room, and then I will be putting on gloves. Now, after I have completed hand hygiene, I've completed putting on my gloves, I'll bring the medications to the bedside table. So here, in this cup, we have the one digoxin tablet that is 125 micrograms. I will be comparing that with the patient's MAR, making sure that the date of birth as we confirmed with the patient, and then look next to the patient's MAR about the dosage and the medication needed, which is digoxin 125 microgram tablet. So as I have the medication, I will be giving this medication to the patient. Before giving the medication, I will be teaching about side effects of, or side symptoms of digoxin toxicity, which is headache, nausea, blurred vision, yellow-greenish vision, vomiting. So make sure that the patient knows that these are symptoms of digoxin toxicity, so they can monitor for that after they have received the medication. So prior to giving the digoxin, you would need to assess the apical heart rate for at least for a minute, because you should not be administering digoxin if the patient's heart rate is lower than 60. So at this time, I will be assessing my patient's heart rate for 60 seconds. So I'm just going to place my stethoscope here, and I'm going to assess your heart rate for 60 seconds. So my patient has a heart rate of 76, so I am able to administer the medication as the patient's heart rate is greater than 60. So as I'm giving this medication to the patient, I will be giving you the cup with the tablet in there, and then we have to witness the patient taking the medication. So, and then you can just give them some water to take the medication with. Okay. So after the patient has taken the oral medication for digoxin, you would come back and monitor their heart rate, their vital signs. You would monitor their EKG to assess for effectiveness of the medication. And then for the second medication that I will be administering, that is the insulin. So as I confirmed the patient's name and date of birth, I compared it with the MAR, which has the patient's name and date of birth on there as well, and then you want to make sure how much insulin you are giving with the patient's sliding scale. So the patient's glucose level was 256, and per the sliding scale, you should give 3 units of insulin if the glucose is between 251 and 300. As shown in the medication room, I withdrew 3 units of insulin and then also confirmed it with another nurse. So when we are giving a subcutaneous injection for insulin, we would be having the patient would be laying down, so you just kind of like lay down. So I would complete hand hygiene again. Before prior to giving the medication, have gloves on. So what I would need is an alcohol swab, in which we would be giving the injection into the subcutaneous area of the right lower quadrant. You would want to assess for any bruising, bleeding, infection, any skin breakdown in that area. So as I'm getting ready to administer the medication, first I will be teaching about the signs and symptoms of hypoglycemia. So that would be anxiety, headache, jitter, shakiness, chills, cold sweats, confusion, just so they can monitor their, so they know what to look out for hypoglycemia. Now, I have my gloves on. I completed hand hygiene. I have the medication next to the bedside table. I explained to the patient that I will be giving a subcutaneous shot into your right lower abdomen. So what I will be doing is first after I assess the skin, I'm going to clean the area with an alcohol swab. And then after I've cleaned the area, I have the syringe next to me, in which I will take the cap off, and then I'm going to pinch the area that I'm going to be giving the medication in. I will be going in at a 90-degree angle. So as I insert the needle, I release my hand from the abdomen. I hold the syringe, and then I slowly administer the insulin. And then after I administer the insulin, I slowly pull out the needle in the same angle that I had injected the insulin. I discard the syringe into a sharps container. Then I would put a cotton swab there. If there's any bleeding, have the patient keep pressure on there. And then after I'm done discarding the syringe, I would then put on a Band-Aid if bleeding continues. And that is all for the medication administration video.